We are live, so welcome and welcome back. Actually, after our couple week hiatus from the, and she's been watching TikToks or
My phone
Facebooks
just
or
turned
something.
off. Decided to alert me that it was doing something.
But a couple weeks off, 4th of July, and then we went on a family vacation, and so now we're back, and we have a case report that we want to go over tonight. In our case report, I'm boring her to death.
No, I'm just suffering.
And our case report is on a 65-year-old female who had all over body aches. Didn't quite call it fibromyalgia, but was acting quite a bit like it. Her lifestyle is she cooks everything at home. She has free range chickens. Basically, they have a small farm. So everything that they do is organic. Hey, Kath. Everything is organic and fresh and blah blah blah. But she comes in and says, "Hey, I am dragon butt. I don't feel good. I hurt all over." And she has some sort of what she have coming up that she's trying to.
Oh, I think it's her son's wedding.
So has a wedding coming
or
up.
Or a vacation or something big, something like that.
And so we start where we always start. We sit down with the patient. We try to get to know them, what has brought them to where they're at. And there's nothing really outstanding in the history, right?
Not really.
No traumas per se, nothing of that nature. And her questionnaire that we have filled out, she scored a 162 symptoms on this. And that's a lot. We start to say anything over 80 is a lot, and normal is 20. And so she's at twice that. So now we've got to start to dig in to see what's going on. And so when your discussions with her, what did she have going on and what did she say to you?
Well, she saw talking about pain and I think uh, maybe bloating and things like that. And I said I was explaining the test to her, and I told her, you maybe most likely you're going to come back with some food sensitivities. And she says, "Oh no, not me. I can eat anything." So I said, "Well, we'll see." And lo and behold, she went through her elimination diet, and by the third week was feeling amazing. But she hadn't started adding anything back yet. And when she started adding things back, she realized really quickly that she had food insensitivities.
And so she ended up coming back. There's less than 1% of the world that is sensitive to monk fruit. And this put her in the hospital for a day. Um, and she has a familial history of that. So we started to go through that. And of course, when we get all the tests back, um, she's third shift worker. So, of course, her cortisol curve is off. And if your cortisol curve is off, what we know of as the HPA axis is off. So there's a lot of stress there. And so we try to normalize that. We use nutritionals to normalize that. And she almost immediately started feeling better and having more energy. She still has energy issues. She still feels a little run down, but she started to feel better. And then she was texting you quite a bit. What did she say?
So she thought she had what wasn't mast cell. What did well, she has
Like
she thought
chronic
she had,
inflammatory response SIRS?
yeah, and so we're going to test her for that. She has a family history of that with siblings. Um, let's see, what else?
One of the things that I have noticed with our patients is those patients who have poor cell health. So the cell wall, we measure that through a bioimpedance analysis. And her bioimpedance analysis started at a 5.7. And that's not good. For her age, she should be at a minimum a 6.2. but she's a 5.7, so that puts her well below that.
And what was the date on that?
May 9th.
So about 10 weeks ago.
Yep. And so she has started the neuroendocrine portion of the program. And we're working on her adrenals. We're tweaking her diet. We got her off of a lot of her stuff that she's allergic to. And she only, or not, I hate saying allergic, sensitive. If you're sensitive to a lot of things, then it's not that you should avoid those foods. You have a leaky gut. You have a gut that is allowing too many food particles through, and you've either lost secretory IgA or you've lost some form of tolerance. We were listening to a practitioner, what is that lady? She's a dietitian.
Oh, it was on one of the TikTok things. She is a registered dietitian, and she was basically talking about, if people are using certain words, they're just doing that to scare you, that, your Cheerios are wonderful for you and you can add them to any well-balanced diet. What was the other thing?
Well, and I immediately kind of looked and said, I don't necessarily agree with that, because we know that through testing that there's more glyphosate per serving than B12. And then she didn't talk anything about looking at your tongue, doing anything to see if you are gluten free or see if you're gluten sensitive.
Yeah, she was talking about you should no food is toxic or poisonous. I guess that's what she was saying.
Well, sometimes dose makes the poison, and that's even with medications. Dose makes the poison. But I listened to that and I was just like, ooh, that's just kind of some sketchy, dangerous stuff, I think, because if you don't know and you have some person in an authority position telling everybody, hey, Cheerios is great, but what happens if you don't know that your detox pathways are compromised? What happens if you don't know that you can't handle glyphosate? And I mean, the biggest lawsuits ever settled have come out of glyphosate, out of California, actually. Largest settlements ever. And it has been linked to all kinds of cancers, and especially lymphomas. So, anyway, back to our patient. She's coming back sensitive to a lot of stuff. So, as we progress through her healing journey, we'll start to see that she's probably not going to be sensitive to everything. But there is a hypothesis for these people there's a hypothesis for these people who are sensitive to eggs, that it is because of eggs are used as an immune activator in some vaccinations. I don't know all of it, but they do use albumin from eggs as part of the vaccination, and they think that some of that is possibly because of that. Don't quite know exactly that thing, but most people, if they avoid eggs for a long time, then they can start to eat them again. She's sensitive to eggs, but if she eats them with things
So she was concerned that she couldn't eat eggs and she couldn't eat dairy and she couldn't eat gluten. And I told her, that just meant she just needed to do a little more work. I mean, we just really started with her. So what we will do is help her with her gut dysbiosis and heal up the gut a little bit. And then most likely she'll be able to add those things back. She was concerned that her chickens were free ranged and they ate good things. And I can eat one egg with something, but if I eat a couple eggs for a couple days, it just tears me up. But
so
I am just sensitive to eggs, but I've always been sensitive to eggs.
So now she's going from the adrenal and she's entering into what we call the neuroendocrine. We're working on her neurotransmitters, because she did show with dysbiosis, she does have H. pylori, and she does have homovanillinic and vanillanolinic acids that are off. And so that tells us her neurotransmitters are off, and that's why she has a lot of the mood swings. But everything else is coming back, so she's ready for that next stage. And we have seen now in her readings that her cell health has jumped way up. And honestly, I'm quite amazed with that, because I've never seen anybody's cell health go a full point in 2 months. Usually we see 1/10 of a point or 2/10 of a point. And she has gone from 5.7 to 6.7, which puts her in the normal range. So we're starting to look at probably going to start a mild detox, work on the liver, getting the liver going a little better and making her feel better. But that's so far she's really happy. She hasn't lost any weight. She still shows as toxic. So one of the metrics that we use to look at toxicity is, what is the water distribution? And as you can see, it's really weird. Our patients, most of the women are toxic. And so just anecdotally, I'm wondering if that's because women typically tend to carry a little more fat than men. Women need to have more fat than men. And I wonder if that's because of that. And
Our dog is a little needy.
yeah, no kidding. And so the toxins and stuff just get packed away in that body fat, and then it's just a bear to get that stuff out.
And although she's working out, she's gained a little weight. However,
She
her
lost 2
pants were literally falling off of her.
Yeah, she's lost
Inches.
lost inches because she's away from the things that are causing inflammation. She lost 2 pounds of body fat, but she picked up biocellular mass because she's walking. And exercise attributes to cell health tremendously. That can't be discounted. You can't ever say it's just one thing that does it, because the body has so many redundant systems. You know, if you're not getting good sleep but you're able to exercise, you won't take as big a hit. If you're able to exercise and sleep but your food is off, you won't take as big a hit. And there are just these wonderful things with the way the body is designed and designed to heal, that it does great. I mean, look at me, for instance, with all of my accidents and injuries recently, and the body just keeps coming back. And on knock wood, haven't killed myself yet. So we're telling you an incomplete case, because this is what we see when people start the elimination diet, when people start the nutritional plan, and they start to work on the elimination diet, and they start their vitamins. We see this all the time. And she, like I said, she's gone from 162 symptoms down to a 135.
Well, and she did text me because she wanted to ramp up her supplements, I think, because she was feeling so good. So she just kept feeling better and better and better, and then she kind of plateaued. But we chuckle because we hear this almost every patient. Like, I just feel so bad again, but yet their scores are so much lower. They just honestly probably just didn't realize how bad they actually felt until they felt better, and then they felt so good that I guess they just expected it to keep going up. But
And now,
they look good, and they feel so much better, and their symptoms go so much lower.
and she's reintroducing foods, so she's been taking hits from those, which we have to explain. If you get into something that you are sensitive to, you're going to have 3 days at least of recuperation time. It takes 3 days to get that out.
Yeah, she's like, well, I've quickly realized that just because I ate it and I didn't have a reaction, that it didn't mean I wasn't going to. So for her, it's about 3 days. On the 3rd day, she starts feeling it. So, but now she's learned her pattern, and and she doesn't want to hurt. So she has eliminated that. So now she wants to kind of help herself along and start, fixing things a little quicker.
Well, she's figured out how to work herself.
Yeah.
Your car. Your body is a vehicle like a car, and you have to learn how to drive it. You have to learn how to maintain it, and everybody's body is different. That's why, as doctors and nurses, we're just educators, and we have to listen to you because you tell us really how you feel, and you tell us really how things are working and going on.
Well, I think it's not even just we give you supplements and help you along.
Yeah.
Like they really learn who they are from their inside out. Like they really start to understand how they tick and how to listen to themselves. Like I eat, gluten, and within 2 hours my knuckle hurts. So, and I know that I'm going to hurt until it's out of my system, and it might take 2 weeks. So it's neat to see people start listening to how they feel and what they need and their cravings. So we're always like, if you just listen to what your body tells you, you'll know exactly what you need. And it's neat to see people grow in that health journey and really start understanding how they work.
And so it's good to see this. It's good to see how she's doing. She's losing body fat. Her cells are getting healthier. She's going exactly as she should. So we will continue down this journey with her.
And it's been deprived of mom and dad for
she's
weeks.
been crazy. And so we will see you next time.